Good morning and welcome to everyone to the 2022 Virtual Compassion Action Healthcare Conference. I am Dr. Beth Lown, Chief Medical Officer at the Schwartz Center. Thank you for joining us for this keynote panel discussion, Leading with Compassion, Challenges and Opportunities. Please welcome me in welcoming, please join me in welcoming our presenters. Tim Voges is the Brownlee O. Curry Jr. Professor of Management and Faculty Director of the Leadership Development Program at Vanderbilt University Owen Graduate School of Management. He is also the Deputy Director of Business Innovations for the Frist Center for Autism and Innovation at Vanderbilt University. Tim will serve as our moderator today. Joining Tim is Dr. Carolyn Clancy, the Assistant Undersecretary for Health, Discovery, Education, and Affiliate Networks at the Veterans Health Administration. Prior to her current position, she served as Acting Deputy Secretary of the Department of Veteran Affairs, the second largest cabinet department, overseeing the development and implementation of enterprise-wide policies, programs, activities, and special interests. We also welcome Dr. Marianne Fuchs, Vice President of Patient Care and System Chief Nurse Executive at Duke University Health System and Associate Dean of Clinical Affairs at Duke University School of Nursing. Dr. Fuchs has also served as the President for the American Organization of Nursing Leadership, which is the national professional association of more than 11,000 nurse leaders, and is a subsidiary of the American Hospital Association. And we also have joining us Pamela Sutton-Wallace, incoming Chief Operating Officer at Yale New Haven Health. Pamela Sutton-Wallace is an accomplished healthcare executive with more than 25 years of experience in healthcare, most recently as Group Senior Vice President and Chief Operating Officer at New York Presbyterian for the Weill Cornell Division. We are very, very thrilled to have everyone with us today, and we're really looking forward to this important discussion. Welcome and thank you. And I'm going to pass this off now to Tim.
Thank you so much, Beth. Thanks for this opportunity. And I'm thrilled to be part of this incredibly accomplished panel and of truly transformational leaders who I think are really expertly positioned to give some cutting edge insight into the hows of compassionate leadership. So we'll just jump right into a little bit of reflection on their own personal practice. So reflecting on your own leadership, how do you try to model or how do you think about compassion in your organizations? And anybody can jump in to get us started.
All right, I will take a dive then. Thank you very much. First, I want to thank the Center for inviting me to join the panel today. Very, very excited about your work with the Healing Healthcare Initiative. You know, compassionate leadership has always been important in healthcare, but the pandemic really reinforced that. Clearly, the goal of trying to build a community of people at an unprecedented time with, you know, all kinds of new dimensions relies a lot on internal communication. So I wanted to give you a couple of examples. One of I can just think of him as a rock star physician, realized A, nobody knew what they were doing, and B, many people felt isolated. So he started a twice a week webcast called COVID in 20 or C20 for short. And, you know, like 200 episodes later, it is almost impossible to imagine our system without it. As a very, very large system, we had internal platforms for communication across the country because that's just part of our everyday work. But we've evolved to a point where we're hearing about cutting edge science twice a week with a kind of wait, don't tell me format, which is really phenomenal. In my own group, you know, we have people across the country overseeing the education programs because we support the training of about 1/3 of US medical residents, as well, and nurses and all kinds of health professionals, and also people overseeing research, which became a huge boon for us. So what became immediately apparent was just how isolated many people felt. People who before didn't, you know, would reluctantly tune into a once a month call, but mostly be, doing other things in the background, now really, really wanted to hear from us at least once a week. And I get it, right? Because everyone felt just completely isolated. The one thing I wish I did that I was very impressed from Boston, Massachusetts, was when I saw a picture of Katrina Armstrong, then at Mass General, actually cutting people's hair, because that just drove people crazy, right? You couldn't get your hair cut. Actually worse for those of you with short hair, but I thought, boy, talk about stepping up. And the last thing I'll say is just hearing from our regional leaders continuously, because we had, meetings like a couple of times a day about what they were doing locally, focusing on making sure people had childcare, making sure people felt safe. That, especially early on, was hugely, hugely important.
Great.
I was just going to echo Carolyn's points. I think they're incredibly important. We learned a lot during the pandemic about communications, right? And I think we all had these very formalized internal mechanisms that we thought were very effective at the time. And I think the pandemic helped us to see that they weren't sufficient. They were necessary, but not sufficient. And I agree that having those more informal podcasts that were very conversational in nature, they reflected questions that our frontline staff had, that we were much more attuned into the needs of our staff. And I think the big question now is, how does this translate into our work today? I dare say I put post-pandemic, I won't call it post-pandemic, but now that we're living with it, right? Living with COVID and whatever else, monkeypox and whatever other issues we're tackling. And I think getting to the core, there has to be a level of authenticity of our leaders. And I think the example that Carolyn gave around Dr. Armstrong cutting people's hair is that core of authenticity of caring. That's not based on a script of what we think are the strategic tactics, but it really underlies listening to our teams, hearing with fresh ears, and maybe listening to different perspectives about what people need. The Great Resignation, I think, is saying that it's all about money, or some people seem to think it's all about money, but we know now it's not, right? It's about flexibility, it's about being heard, it's about removing barriers so that people can do their work. And I think the only way you can get after that is to be authentic, to be listening, to be gracious. And those sound like such fluffy, soft skills, right? And we have, I think, trivialized those skills, but in fact, they've become essential for the modern day leader.
I would jump in and echo what my colleagues have said here so far. When you think about what the whole world has experienced over the past couple of years, just life-changing at every level. And each of our colleagues show up every day with a different set of life experiences. And so while we can be empathetic and try to understand, that whole piece around compassion is, what do you do? What are the actions that you take? And so as a health system, so for example, our core value is caring for our patients, their loved ones, and each other. Well, that's probably in most healthcare organizations that we do, but what the real learnings have been is caring for each other over this past couple of years, especially, and what do we do at each level? And so I won't go about that whole communication piece, which we've talked a lot about, but really thinking about just even at a basic level, if you go to Maslow, right, and understand that people during this time had some very basic needs around safety, needs around just caring and belonging, and basic needs. So many of our workforce, for example, didn't work during this time. We chose as a health system to keep them employed. That didn't exist in many places. So our approach was to make sure that if we took care of our workforce, we were caring for our broader community and promoting health to start. And then listening to what people needed, whether there were issues with food or housing or transportation, or however, whatever those individual needs were, building the systems and structures to support that in a broader fashion became really even more important. And then taking our daily management systems and reframing our management systems, our huddles, to start with that, to hear what the concerns were from all of our entities across our system, from our departments, and to use that to funnel that to be able to address those needs became even more important, which allowed us through that listening then to really try to develop more of the support programs for our staff, whether they were peer-to-peer programs for support, whether they were more formal services and counseling that people needed through personal assistance, whether it took our organization to work with our insurer to increase the number of sessions that people were allowed for formal counseling if they needed, putting in a program for our managers to be able to help them support their team members. So down to even something which I think has had the most impact in our organization is leaders traveling around with a coffee and water cart to our employees, right? Not making our employees go somewhere to seek, but to be present. And I think during this pandemic, some of those learnings and some of those basic needs and that presence became even more important.
That's a great holistic set of recommendations across the three of you, about some fundamental rethinking about how you do and engage with the everyday, how you have more authentic care and action, and some strategies for meaningful and engaged communication, and also some really concrete structural practices that can be put into place. Now, a couple of things that came up were issues related to isolation, the Great Resignation. I'm wondering, what are the types of issues related to compassion, be they workforce issues or patient care issues, that are keeping you up at night?
Well, I think we described some of the workforce issues, right? That, every day we're finding the challenges of retaining our top talent and recruiting talent. And I think we have to take some of the lessons that we learned during the pandemic and translate them into everyday new practices. As Marianne said, just kind of reassembling our daily management systems becomes critically important, right? Our teams tell us when they're frustrated, they build workarounds. And when we have these internal communications tools, when we're present, we learn pretty quickly where those workarounds are happening, where our daily management systems are failing our teams. And it's incumbent upon us to raise those up a level. I think we all have huddles, right? We all are using some variation of Lean, Six Sigma, but are we really taking what we're learning in those forums and removing the barriers to doing the work of every day, right? And I think we've long heard the frustrations of the EMR. It's not just because, it's not the technology itself, it's the cumbersome workflows that we've put in place that have frustrated every level of our team. And so for me, it's that constantly trying to think about how can we have a mindset of continuous improvement on the day-to-day work. I would say the second thing that keeps me up at night, so to speak, is how do we protect our staff from a psychological safety, and now even more importantly, physical safety. The level of violence against our caregivers is unprecedented. And I think, I know we'll talk about it later, but I think it's absolutely incumbent upon us to figure out how do we systematically change the ramifications, consequences of those who by choice harm our caregivers.
Yeah, I guess I would chime in and really foot stomp everything you just said, Pamela. Burnout is a big issue that makes me worried. We have a very, very mission-focused workforce, but it's fraying. I don't mean the people are fraying, but this sense of we're all on this together and there's nothing that we can't do to help these veterans. And some of our people were just totally awesome. And we took a lot of time and were very intentional about celebrating that. An employee also in Boston who figured out that we could repurpose Uber and Lyft contracts to send them, because we weren't having veterans come in for visits, right? So he had them going to food banks to pick up and deliver food to veterans who were terribly isolated and otherwise had no means of getting food. And, but that's just like one of many, many examples. I'm sure that many of you are aware that the Surgeon General recently released a report emphasizing two big issues. Number one, burnout is not new for doctors and nurses in particular, but many, many others. This was pretty prevalent prior to COVID. I think the early response to the pandemic made people almost forget about it, but then it got old, right? It got old when people didn't want to be vaccinated, and we could all list all of this. And that kind of distress, coupled with the fact that some individuals have an easier time saying, I'm stressed and I've had it, I need a day off, or I need more flexibility. And others actually don't have that language, right? They've not been in a position where it's okay, or they feel like they've got to be strong and so forth. So we're now in a situation where we're expecting to be short the country of 1 million nurses by the end of calendar year 22. Can you even imagine what March of 2020 would have been without 1 million nurses? Now, we have tracked this because, like all good organizations, we have an ongoing survey, and we actually have a center that focuses on this, a National Center for Organization and Development, and we added items related to the pandemic. And what was fascinating to me was in 20, we could see some signs. The following year, much, much more. I think, first of all, I'm sure I'm not the only person who thought this was going to be kind of a much shorter duration than it's turned out to be. But the cumulative burden, I think, is really tough. So our most recent survey found that about half of our workforce reported at least one factor related to burnout. That is just craziness. One last thing I would just say is one of the activities we launched a little over a year ago is helping people to imagine, how do we build on the capabilities and flexibilities? This is sort of focusing on the positive. Do we imagine that all these veterans who now use virtual platforms and so forth are going to want to come back in and so forth? So we actually launched a big initiative, human-centered design, focused on reimagining veteran health and healthcare. And as you might imagine, there's a variety of opinions, but we also use this as a way to engage our employees. And many are very, very excited about the innovation. And the very clear message we got back was, we want to stay involved, which I thought was just awesome. Although drifting back to our usual ways, we might have been tempted to imagine once again that only at headquarters do we have original ideas. Everyone else are just implementers, right? But that message for me was very, very powerful.
Reflecting on some of the comments that have already been made, I would add the American Organization for Nursing Leadership actually did a longitudinal study over the time in the pandemic, and hopefully we'll get to the fourth iteration of that study that really examined our nurse leaders across the country and their experiences. And as you can imagine, in the beginning, it was all around supplies and trying to emergently learn new things and change things every day. But today, it is all about their health, their mental health. More than 25% of our nurse leaders across the country say that their mental health is not safe, right? They are very afraid for themselves. And second, that's what they manage in their workforce every day. And then on top of what was said about the shortage, we had an impending shortage. We've had burnout. Everything has just amplified this. When I lose sleep over is making sure that people can come to work every day and practice in a way that's going to make them feel satisfied. Many of our nurses today, and you can look at the data that's out there that's been done from surveys from ANA and all, different organizations, is that our staff have a lot of moral distress about what they can and cannot do and can provide for the people they care for every single day. So making sure that they have what they need in order to be able to do that, whether it's redesign workflows so that they can spend time with the people that they need. And, a big piece that Pam talked about was that whole documentation. The EHR is a big issue. And what we can do about that, I think, becomes even more important. As we think about, the Great Resignation, and I think about being a nurse, I don't think there's ever a better time or more opportunity for being a nurse. Quite frankly, I'm pretty proud of the nurses and all of our healthcare workers across the country and everything that we've done. This Great Resignation is hitting everyone in every area. And how we have tried to manage that within our organization is to really go back and look at what people can do within their scope of education and training, and make sure that we're providing those opportunities for people to be able to do that by redesigning care, developing new care models, so that we're using people in a way to help them practice to their top scope. We're also taking this great opportunity to rethink about our workforce development programs, and to think about the people right now within our organization that we can either partner with at external organizations, companies, colleges, et cetera, to help them grow. Because what that does for people is it helps build that loyalty and that trust as an organization, and help people to be able to see a future during this process. I would comment in addition, there's a tremendous work going on now with the American Hospital Association around workforce and around workplace violence. And I think that as Pam said, those are two top areas that we have to continue not to only look at local solutions, regional solutions, but national solutions. And it is good that we have so many great colleagues across the country focusing in that area.
Tim, I just wanted to jump in on one other thought.
Please.
I was thinking that in addition to what we've all faced together, and it just seems to be endless, of course, we had a presidential election, which if you work in executive branch department brings a lot of change. So the first time we ever had transition teams, instead of coming to the building and meeting with us, it was all virtual and so forth. But we are also my building around the corner from Black Lives Matter Plaza. And so locally in DC, I would say we were seeing a lot of overreaction to any kind of, I'll put this in quotes, demonstration. When the president went over and stood in front of the church, that is, you could throw a stone from there. There's graffiti on our building and broken windows, but most of it was not violent. And this played out across the country in very, very different ways. So I was quite impressed with how many of our leaders had the kinds of conversations they had never, ever before had with employees, and they learned a lot. And they didn't attempt to say, oh, well, then we'll start a new program here. They listened, and that came across loud and clear, which is not to say that we have answers, but that I hear you, and that how this is impacting you is more important to me than anything else right now. You have my full attention, presence, and so forth.
Yeah, and that is a potential starting point of a strategy for how do you engage these deep senses of moral distress and mental health and well-being and burnout, right? Like engage in that deep listening, and it kind of carries forward some of the things that we're saying about how do you really enact compassionate leadership. And I think one thing I heard, in response to this question, a little even more was the kind of systematic rethinking of delivery processes, be they human-centered design, be they more kind of that continuous improvement mindset where you're doing the fixes and showing the fixes, right? Like to say, we're going to take out of the way those things that are a nuisance and a threat to your mental health and well-being on a daily basis. So kind of building on some of the things you all were saying about flexibility, continuous improvement, and kind of structured interventions, are there anything other things that we need to be thinking and rethinking about work in the workplace to meet the needs of today's workforce, to reflect some of the lessons of the pandemic? And I think some of what Mary Ann was closing with too, with some of these investments in the workforce too, certainly speak to that as well.
Yeah, I think one point that Mary Ann brought up that I really want to echo is the need for the interprofessional connections. Mary Ann spoke about nursing in particular working at the top of their license, but I really think it's incumbent upon us to sit down together as interprofessionals, whether we're talking about, respiratory therapists, pharmacists, nursing, physicians, advanced practice providers, our transporters, our EVS staff, the whole spectrum, so that everyone is functioning at the top of their license and has an appreciation for the work that each member of the team brings, right? And I think we're very good at saying this in words, but how do you bring those teams together at a very local level and get them out of their silos of accountability up through kind of their division, so to speak, right, to whomever they report, and have them really function cross-functionally, and having real clarity about who's doing what and how important the what is, no matter what part of the discipline you're in, and really allowing people to have a range of practice so that those who are focused on direct caregiving can truly focus on direct caregiving. And I think this has a lot to do with, I think, Tim, what some of your area of expertise is organizational development and manager development and alignment of one structure. And how do we get those teams to interact and give them time together? Right, we are so fixated right now on staffing levels, especially as financials for almost every healthcare organization is challenged. But how do we give people time to sit with one another and map out those processes and those activities that are being done so that they can connect better as a team, serve as support for one another? At New York Presbyterian, we did some work in our surgical ICU that really started because of moral distress experienced by nursing. And I know the same happened at UVA, and I think Duke has done some work here too, is listening to the moral distress, as Mary Ann said. And often that became because people haven't communicated one with another about what the care plan is and who's doing what, who's the decision maker in those caregiving moments. Really simple things like who's going to ensure that the patient has the right diet or is on hospice, having those regular moments for connection as a caregiving team. To be clear, those daily, I'm going to use the word microaggressions, but I'm not sure that's what I'm looking for, but those daily insults of moral injury are really creating the climate that we want to eliminate, that really is getting after the compassionate care in a very actionable way.
Yeah, I noticed a comment in the chat about not mentioning chaplains as part of the healthcare team. And I think it was a good pickup, hugely important for us at VA. Early in the pandemic, we were having meetings literally 7 days a week, twice a day. This is across many leaders and people across the field. A couple of times a week, we put aside time to hear from the chaplain, which helped. Now, this is the chaplain at headquarters, but all of our facilities have them. They've been very, very powerful, as they have been throughout our providing veterans the care they need. The secretary has also been very, very impressed with the work of VA employees, launched his own 10-point plan. And step 7 focuses on supporting employee wellness and burnout. So we established something, because we have to have an acronym for everything, a reboot task force, which is reduce employee burnout and optimize organizational thriving. We also turned our employees on, and the level of participation has just been amazing. In addition to that, we have a program for veterans, which is called Whole Health, which really is all about changing the paradigm of healthcare from what some would call find it and fix it. What's your problem today? I'll see what's in my closet that we can fix it. To what are your goals? What matters to you? Very strong emphasis on a much broader range of therapies, whether that's Tai Chi, yoga, acupuncture, and so forth. And we've made those available for employees. And I've noticed when I visit facilities during this time, which hasn't been terribly often, but one of the first things that leaders at a facility want to show me is the dedicated space they have for employees to take a quote unquote timeout or need some meditation or quiet time. And at one point I whispered in one of these rooms, well, you would have thought I had just like dropped gasoline in a match on the floor. It was worse than any library I've ever been in, but that respectful of the need for people to step aside and do that. The one other thing that I love, and I hadn't been paying attention to, the Reboot Task Force encouraged people to express their gratitude to their colleagues. So people will get these little emails from, people all over the place expressing their gratitude. And I have to say, when I've gotten them, it's sort of like, whoa, a bright moment this morning. This is really terrific. And I've been very impressed with how many people have stepped up to do that. This is not an award application that you have to fill out stuff. It's just saying, I appreciate you.
And I would say that recognition every day is what keeps people going, right? It really is not the need for an award. I just would make another comment here, and to Pam's comment about all of our disciplines. As we have thought through the lessons of the pandemic, we continue to think about what we've had to do in a very hurried way across our entire care continuum, right? So it's not about the walls of one place where we would provide care. It's like, how do we need to change the systems and processes to support the people wherever they are? And what can we do differently today that we didn't think we could do? I go back and think about just telehealth and the impact of telehealth today than prior to the pandemic, right? There were early adopters. Most people were late adopters, right? And now today we do physical therapy. We provide emotional support. We do all different types of things via telehealth that we didn't do today, which has allowed us to really think about how we reflect upon the role of all of our care providers. And to echo what Pam, with the comment that was about chaplains in the chat, oh my gosh, the chaplains and social workers are at the core of everything we did during the pandemic, right? And part of an incredible care team moving forward. But when we think about the pandemic and we think about how we use telehealth, how we had pilot programs about hospital at home, how we have totally changed how we deliver care, it has allowed us to say, does what we're doing today really need to be done in a hospital setting or a clinic setting? Can it be done at home? And how do we maximize all of our resources with our communities to be able to do that? And, when I think about our organization, we were in the midst of a major shift in development of our strategic plan. The pandemic helped us to totally reframe our strategic plan and really brought into the learnings, the learnings I think that we knew, but that became exaggerated and even more important around just the social determinants of health and how we frame services differently and really place the emphasis, because we knew about and learned from the outcomes of care that we were seeing nationally around people who couldn't access care, or around people who couldn't or who delayed their care during the pandemic and didn't have access. So I think that the pandemic has allowed us to think about how how we focus, how we invest resources differently, and how we provide that care differently across the entire continuum of care, which I think is a real positive for us moving forward. And we've got to continue to capitalize on all of those learnings moving forward.
I think one of the things too that our teams were most impressed by was how quickly we pivoted during the pandemic, right? And bringing that same level of urgency for the other things that Carolyn and Marianne have talked about, that can we bring that same level of quickness, nimbleness? I know many people are often frustrated about how long we take to make some of those crucial decisions, despite having sufficient evidence that the change is needed. I think that was an important learning as well.
That's great. These are a great set of insights around really, supporting people where they are and reorganizing work around that and being nimble in doing so and creating deep and meaningful interprofessional connections and real cross-understanding, and also recognizing and showing gratitude for others as we go. So when you think about where an organization might get more traction in making change happen, who do you see as the as some key carriers of change in your organizations?
Well, personally, I see our middle managers, being the people who make it happen every day. They lead their teams at a local level. Staff trust their local level leader more than anyone else. So the systems, structures, and support we put around those managers and supervisors becomes even more important. And this is organization-wide. I'm not speaking to just nursing. It is organization-wide. So making sure that their workload is appropriate. Some of the learnings that we had during the pandemic were the workforce that we let work remotely actually left some of their work on the frontline managers who were showing up every day. And it really became an impediment to the manager's success in being able to be focused on the work that they needed to do with their people every day. So making sure that we, develop push versus pull systems for managers so that they have access to information and resources in order to do their jobs in a way that is the most efficient for them. Making sure that there's a consistent use of a management system around them to be able to respond to their needs in addition, and understanding, I think, their individual needs for flexibility. I think in giving them permission to not have to show up every day in addition. So what can you do to support those leaders in addition to be able to make it happen, because they're the ones every single day that are escalating the concerns, helping to develop the new innovations, and working with the teams to be able to get it done.
That was so incredibly well said. One of the Gestalt impressions I have during the pandemic was, the liberation from a lot of rules and regulations was very liberating. Now, I don't imagine we're going to have future timeouts where we just say, well, we're now in endemic phase and we're doing it really well. But once a month, we're going to have, a day off from regulations. But if you think about it, this culture of compliance, as opposed to I'm using all of my skills and capabilities to deliver on the mission, which is what keeps me here and keeps me excited about the work, I think was hugely important. And I do think that moving into the future, it's going to be hugely important using all the tools that Marianne just described and so forth to be able to do that, right? Your job is not just go over these incredibly long checklists to make sure that we're complying with all kinds of things. Not that that's meaningless, but that you're constantly looking to your employees for what are their best ideas and how can we do it better. One example that came from one of our medical centers in New York, and they leaned forward in a big way because many of you may not be aware that VA has a fourth mission, which is being sort of a backup safety net during public health emergencies. So we admitted somewhere between 500 and 600 non-veterans over the course of the past couple of years. But one area where we had a lot of problems, especially pre-vaccine, was inpatient mental health. Now, a big part of the reason that you come in for inpatient mental health, besides protection of someone who may be unsafe, right, is for group therapy. But we have social distancing, we can't do that. But one leader told me, a middle manager came to her and said, you got to get out of my way because we think we've got a way to do this. And, you know, through frequent testing protocols and so forth, they could actually separate folks who had been infected, who hadn't been, so that they could continue group treatment. And I thought, this is amazing. And I kept asking the leader, so how did you do this? And the response was, I got out of the way because they could see what the veterans needed.
I agree. I think that's a really important point of how do we get out of our manager's way or bring to bear the resources that are needed to do their jobs well. And I mentioned earlier, giving them the gift of time. Maybe it's not a gift, the necessity of time to work with their teams to really understand. And I see a little bit in the chat too, just the financial constraints are difficult, right? I think this is where we're going to struggle over the next several years, that as our organizations try to get back into some level of financial viability that's not relying on the CARES or FEMA dollars that are available to us, how do we continue to invest in the human resources that are needed? Whether you're talking about managers who, you know, some managers now have, 50 FTEs, you can't provide good support with 50 FTEs, right? And giving good coaching, good systems reviews, being compassionate, taking time to really evaluate daily systems and workflows with that level of accountability. And so I think we have to be thoughtful about how do we invest in a different way in that. And these aren't easy answers. It's easy for us to say kind of on the panel, let's take these strategies. But as someone mentioned, you have to make the justification for it. And I think one can pretty easily start doing that when you look at the cost of turnover, the cost of recruiting new staff to fill these vacancies, the quality and safety impact of having a constant turnover and revolving door. These become the softer analyses that have to be done, but I think are really strategically important for a high-performing organization or a high-reliability organization.
That's great. And thank you for these insights, especially kind of focusing our attention on the middle manager who sometimes gets lost in some of these conversations that are either very strategic or very operational. So if you're advising other organizations where and how to invest to meet the workforce, workplace, and patient care challenges compassionately, what would you suggest be the #1 priority of those kind of investments?
I don't know if there's one definite priority. That's why I'm trying to choose. But we've touched on workplace safety and safety from the perspective of the world around us today. We live in a very different world that our teams are having to manage through every single day. Whether there's true violence, gun violence, gang violence, whether there is psychological safety within organizations to feel like you can speak up. I really believe that, as we step through the pandemic, our teams are now, they have been challenged during this time, but there's still this piece now around the probably not being as articulate, but the people we serve are challenged. They have emotional needs that they're bringing to our organizations that make it really tough for us to care for people. And the interactions that our staff are having to have with some of our patients and visitors become even more challenging for our teams to do their work. So I really do think that the support of our teams, making sure that they have a safe environment to practice in, is really, it's a basic and to me, probably the most important need that we have.
I think one of the areas that there was a lot of focus on pre-pandemic, and we're going to have to kind of bring our energy back to it, is really our partnerships with our community-based, faith-based, and social organizations. We have long known that 80% of health is not related or is related to non-healthcare delivery systems. And so how do we think strategically about partnerships with community-based organizations who do some of the very things that Mary Ann describes exceptionally well? And how do we co-invest in some of those strategies, whether it's to deal with homelessness, whether it's to deal with food insecurity, food deserts, whether it's mental health outside of the healthcare system. I think these are going to be really important collaborations and investments that healthcare organizations will have to make in the future. Just the complexity of our lives really is necessitating a multi-pronged approach to our well-being that can't rest solely in the healthcare delivery system. I think about, when we talk to some of our teams about some of their struggles, and this was kind of, after the most acute phase, we found that some of our own workforce, was struggling with homelessness, struggling with food insecurity. And we set up at your Presbyterian economic support for families, especially families who had lost a breadwinner from COVID. But how do we think about that in the long term, right? And this is coming from a place that, and I'll air quote it a little bit, right? A living wage. I don't know what a living wage in New York City looks like, but we feel like we try to offer a wage that is sustainable for people. But given the enormity of that, thankfully people were disclosing of those situations, but imagine how many families are struggling and don't want to disclose something so sensitive. So how do we work with other organizations to undergird some of those safety nets that are beyond the healthcare system?
So
went on mute
go ahead,
for a minute.
Yeah.
I just wanted to add to what has been said, which was terrific. I think better, smarter use of technology that's more flexible and that actually works in a pretty easy way is where we've got to get to. I get cybersecurity and all of that kind of stuff, but during the pandemic, we actually had to consult with people to say what's going to make this work. And I will say people in our system were extraordinarily creative. For example, one facility created a partnership with the local fire department who would actually go to veterans' homes and help them with the onboarding and getting ready for a video visit. Now, if you think about it, there's a little bit of enlightened self-interest there, right? If the veteran can't reach us, these are some of the very same people who they will have to bring in sort of in an emergent situation. But, the idea that someone would think that way, and frankly, we had to relax some rules about using FaceTime and stuff that didn't have 10 levels of security on it, because right now it's much more important to treat veterans and make sure that we can reach them. So I'm hoping that trend can continue, because it really places a lot of value on what the people doing the work need, as opposed to, where is it in this huge package of stuff we just bought?
Great. These are great insights about kind of broadening out the scope a little bit to think about that workplace safety, think about those community partnerships, and even start to kind of touch on kind of maybe public policy type implications here. So we're at a point in the session where we're starting to see some questions accumulate in the chat and in the Q&A. So I'm going to turn to a few of those. So one question that we got was, where do you find support yourselves so that you can show up and care for others?
That's a bad sign when all of us are silent.
Yeah.
What do you mean? We're focused on everybody else, right?
For me, I just feel we have an incredible team here, and we have been very supportive of one another and tried to make sure that we each got breaks and had time off, and that I think has been really important. But for me, so I'm an animal lover. I have 3 to 4 dogs at any time. We rescue them. My peace and my relaxation was being able to go home and make sure that I could spend time walking my dogs to clear my mind, to get some exercise. I think that for each person, we sort of know what helps us, and making sure that we find time for that. That's what really helped me.
Yeah, I would say for me, exercise was hugely important. And also finding other ways to engage with people. I mean, some of this was purely workplace. I would schedule these informal opportunities for conversation, and we were not talking about day-to-day work. We were talking about how are you living with this. Unlike most of the employees in my group, I actually came in every day because I wanted to know between the lines of the slides would be showing online, right? How are we doing that? And it was really very, very gratifying for me to be able to learn all that. But also it was a different kind of isolation, right? So I was like simulating what felt like normal life, except, there are very, very few people in the building and so forth. So that part I miss, but trying to figure out other ways to reach out to people and including Zoom calls with family and so forth, helped a lot.
And I would say for me, what I found was hugely helpful, not just during the pandemic, but even now, is connecting to nature. I find great, relief, respite when just taking a casual walk or listening to water and water streams. We've actually tried to recreate some of that in respite rooms for our staff. Not quite the same, but I do think it's just having space, fresh air, and walking around, looking up, looking around, just being people watching, just simple things like that, getting out of the day-to-day. I think also now trying to safely get out of Zoom land, and finding time to spend with people one-on-one safely, to the extent that we can, or small groups, to really just reconnect back. And also, my colleagues have taught me how to take your time off, right? And really, that's why we have it. And I found so many people are reluctant to take their time off, especially during COVID, they were reluctant to take their time off. But how important it is to really disconnect. And yes, I stay connected by my phone and all those kind of things. A lot of people say, you completely disconnect. I find that's more stressful to completely disconnect, because you come back to just a litany of things that you're then trying to catch up on. But I think finding time, and now that, you can, and I feel like I can safely travel, still well protected, finding, just nice spaces to go to and enjoy rest.
Great. These are really great practices. One other question that we had a little bit earlier in the session was, in response to some of the conversation about telehealth and kind of remote things, this questioner asks, things can be done at home, but how do we supply the caregivers to care at home? We don't have enough staff for the facilities. So any thoughts on kind of strategies for approaching that?
I would echo something that Pam said before. Care is mostly provided in our communities, and it's provided not just necessarily by healthcare providers. It is provided by people, family members, community agencies, different types of organizations. So those partnerships, I think, are become even more important. We've actually, in addition, through the pandemic, developed a whole new approach to caregiving programs that engage people from our community, patient or family members, other types of people who may be in the community who can tap into and want to be supportive. So I think developing those kinds of resources become even more important. And as we think about care in the home or care in the community somewhere, I think we have to also understand the safety around virtual care, because there is a lot that can be provided virtually where someone doesn't have to actually physically go and provide. The use of technology, remote monitoring, different types of resources that can actually provide the information that others might need in order to help direct care, escalate care, change a course of care, become even more important.
Yeah, so let me just say kudos to the person who asked this question, because it's hugely important and extremely relevant in my own daily life. We have been funding a Caregivers Center of Excellence to, acquire and collect a lot of facts from surveys and other tools about what are the challenges of providing care to a family member or whomever. We're now just about to launch a new kind of partnership, figuring out how do we support those caregivers. Now that more and more people are more at ease with virtual platforms, that's going to be one obvious path, but it's going to be a voyage of discovery for sure in trying to figure this out.
Great. Before I turn it back over to Beth to close us out, I'm wondering if I could turn it back over to you all to kind of maybe any kind of closing remarks or thoughts you have, or any kind of biggest personal learning maybe you had over the course of the personal learning about leadership that you had over the course of the past 2 years with the pandemic.
Yeah, just to kind of wrap up, it's funny, I attended a small conference last week, and one of the speakers who just was very vulnerable in her delivery of a message, at the end she said, "This stuff is hard." And she didn't say stuff, but this is hard. And I think just an acknowledgement, those collective sigh that everyone had in the room when she said that was so empowering, such a vulnerable moment. But to give ourselves a little grace. I think compassion and grace go a little bit hand in hand, that these are challenging times. This work is difficult. We don't all have the right answers. I saw someone in here, how important it is to share best practices. I think it is important that we learn and have be very vulnerable and disclosing and transparent so that we can share best practices and acknowledge that this work is hard. And then together, in the spirit of collaboration and making better health and better health care, that we work together as we forge that ahead. I think that was one of my biggest learnings, and also the power of our voices, and both individually and collectively. I think that's going to be essential as we move forward around safety, professional and physical safety, as well as we look at policies. And Carolyn mentioned regulatory burdens that we're managing, that perhaps we can do differently, and using our voices to make those changes.
Pamela, that was just so awesome. Thank you. If I were to add one thing to that, I think it's got to be part of the new normal, whatever that means exactly, that we are creating space at all times. That, in other words, listening to employees, that kind of engagement and liberation part of the new normal, rather than an emergency set of tools we had to use, but we're going back to what we used to do. And creating space and being intentional about it takes time. And it's also something I think that we kind of learn from each other, which is kind of a twist on the shared vulnerability. It is hard, right? And particularly if you've never done that, if you're an agenda kind of person, this feels like antithetical to who you are, but it is huge, huge.
So I would, thank you so much for the comments that have already been made, because I totally agree with them. And I guess, when we think about the future, I mean, the opportunities are endless. And I think what we should see in the sort of chaos that we've lived through over the past several years, that there are a lot of great innovations, a lot of just opportunities that we have the ability to continue to expand upon. And if we can build upon the policy that's needed to support some of these learnings moving forward, to lessen maybe the regulation around some of what we learned in this time moving forward, we have the opportunity, the platform, to create something totally new that it could be a much more sustainable healthcare system for us. So that's what I would say.
Great. Thank you for those great insights, and thank you for all your insights during this panel. I think we're all privileged to be in the presence of such brilliant healthcare leaders. I've certainly learned a lot, and I hope you all have too. I'm going to now turn it over to Beth to close us out.
Well, thank you, all of you. I've been taking copious notes. It's really an important and helpful and kind of heartfelt conversation. So I really, really want to thank all of you for your humility, your honesty, and your willingness to just share of yourself. Thank you. Thank you. So I also want to thank our audience for being here. We had a huge crowd, actually, and we would like also to thank our national business members as always, because we couldn't have a conference without them. We're going to take a 15-minute break, and then we'll see you all for your breakout sessions. Just refer back to Attendee Hub to select your next session, and have a wonderful, informative, great day. Thank you to everyone.